Rabies signs: transmission, control, prevention. Rabies is a viral disease that affects the central nervous system and is usually transmitted to humans through the bite of an infected animal, commonly from dogs, bats, raccoons, and other wildlife. Animals that can transmit rabies: dogs, cats, bats, raccoons, skunks, foxes, coyotes, mongooses, jackals, wolves, ferrets, in some regions. It's important to note that while these animals are commonly associated with rabies transmission, any mammal can potentially carry the rabies virus. Animals that are typically considered low risk or almost never transmit rabies: small rodents, e.g., squirrels, hamsters, mice, and rats, rabbits, opossums, guinea pigs, birds, including chickens, ducks, and songbirds, reptiles, e.g., snakes, lizards, and turtles. Additionally, in regions where rabies is prevalent, domestic animals such as cats and dogs can also be infected, so keeping them vaccinated is essential for preventing the spread of rabies to humans and other animals. If you encounter an animal that is acting strangely or shows signs of illness, it's best to contact animal control or local health authorities for assistance. Rabies is a serious and life-threatening condition, so it's crucial to be aware of its signs, causes, risks, treatments, and preventive measures. Here's some information on each aspect. Signs and symptoms of rabies. The symptoms of rabies can vary and typically appear in two phases. Prodromal phase. This phase lasts for 2 to 10 days and includes symptoms such as fever, headache, fatigue, and discomfort at the site of the animal bite. Furious or encephalitic phase. This phase is characterized by more severe symptoms, including hyperactivity, hallucinations, aggression, and difficulty swallowing. Patients may exhibit hydrophobia, fear of water, due to the inability to swallow. Causes and transmission of rabies. Rabies is caused by the rabies virus, which belongs to the lyssavirus genus. The virus is usually transmitted to humans through the saliva of infected animals, typically through bites or scratches. Common sources of rabies transmission include infected dogs, bats, raccoons, skunks, and foxes. Risks and high-risk activities. Certain factors and activities can increase the risk of exposure to rabies. 1. Living in or traveling to regions with a high incidence of rabies. 2. Handling or interacting with wild animals, especially bats. 3. Handling stray or potentially infected animals. 4. Delaying or not seeking medical treatment after an animal bite or scratch. Treatment. Rabies is almost always fatal once symptoms appear. Therefore, immediate medical attention is crucial if you suspect exposure to the virus. The treatment typically involves 1. Post-exposure prophylaxis, PEP. This consists of a series of rabies vaccinations administered after potential exposure to the virus. 1. PEP is highly effective in preventing the onset of symptoms if administered promptly. Home remedies and prevention. There are no effective home remedies for rabies, and it is not a condition that can be treated at home. Prevention is essential, and the following measures can help reduce the risk of rabies. Vaccinate pets. Ensure that your pets, particularly dogs and cats, are up to date on their rabies vaccinations. Avoid contact with wild or stray animals. Do not approach or handle wild animals, especially if they appear sick or behave strangely. Seek medical attention after potential exposure. If you are bitten or scratched by an animal, wash the wound thoroughly with soap and water and seek immediate medical attention. Rabies vaccination for high-risk individuals. People working with animals or in high-risk areas may consider pre-exposure prophylaxis, pre-exposure vaccination, to protect against rabies. Remember, rabies is a serious and deadly disease, and any suspicion of exposure to the virus should be taken seriously. Always consult a healthcare professional or a doctor if you have concerns about rabies or any potential exposure. There is no specific vaccine available for humans after a dog bite. However, there is a preventive treatment called the rabies vaccine that is administered after a potential exposure to rabies, such as a dog bite. Rabies is a deadly viral disease that can be transmitted from infected animals to humans through bites or scratches. The post-exposure prophylaxis (PEP) for rabies typically consists of the following: wound cleaning. Immediate and thorough washing of the wound with soap and water is essential to reduce the chance of infection. Rabies vaccine. The rabies vaccine is given to individuals who have been exposed to the virus. The vaccine is highly effective in preventing rabies if administered promptly after exposure. Rabies immune globulin (RIG). In addition to the vaccine, some individuals may also receive rabies immune globulin. This is a concentrated solution of antibodies that provides immediate but short-term protection against rabies. If you've been bitten or scratched by a dog, or any other animal that you suspect may have rabies, or if you are unsure of its vaccination status, it's crucial to seek medical attention immediately. Rabies is almost always fatal once symptoms appear, so timely medical intervention is essential to prevent the disease from developing. Contact your healthcare provider or visit the nearest medical facility as soon as possible after the incident. Please note that medical recommendations and information may change over time, so I recommend consulting a healthcare professional or local health authorities for the most up-to-date guidance on rabies vaccination and post-exposure treatment in your region. Thanks for watching.